my name is Randy Neiswonger. Welcome to this episode of Community Beat. Today I have Jill Connor. Jill,
hi.
Good to see you. Thanks for joining us. Can you tell the audience a little bit about what you do for Community Hospital?
Sure. I am an administrative director here over neuroscience services as well as structural heart services.
So neuroscience is, so hospitals tend to treat a core group of patients, neuro patients being one of them. Can you tell us a little bit about what neuro patients we treat here at Community?
So when we talk about neurosciences, we talk about stroke, we talk about movement disorders like Parkinson's or essential tremor disease. We talk about general neurology, which has like seizure patients, different neurodegenerative disorders like multiple sclerosis, and we also do spine patients.
Wonderful. I know that that's not all encompassing because I know that neuro can be really vast. I know that there's malignancies as well that
Correct.
we all have to be mindful of, and I think that that is one of those areas that is very important for our patients, and we do it quite well. We actually have some designations that are recognitions for our services here at the hospital. Can you talk through some of those recognitions?
We are a Joint Commission certified comprehensive stroke center. We are only one of 5 in the state of Indiana. And what that means is that we actually care for patients here as they would at our academic centers in the city. So instead of having to go to a local hospital and be transferred when you have a complex neuro disorder or stroke, you can be treated here at the hospital. We also are a regional transfer center. So if you live in the neighboring counties of Porter County or Jasper County or Newton County, and you go to a hospital there, you can certainly be transferred here for your services. And we are able to treat complex stroke, meaning stroke, aneurysms, any of the, as Randy said, brain tumors, and high-level type neural disorders in our units here.
Yeah, that's really nice because I know that sometimes the cliche, at least what people say, is time is tissue.
Correct.
So the faster that we get to definitive care for these stroke patients, it's really important for their recovery and their resolution of their underlying disease process.
Right.
Can you talk about the patient experience when they get here and what they can expect, and then maybe even after hospitalization, the offerings that we have for our...
So as he said, time is brain, and that's kind of the montage when you're talking about stroke patients, and we want to get you here as quickly as possible so we can treat you. And there's medical management and there's surgical management that are available. So we may either give you a clot busting medication so that that brain tissue is revised, or we can take you in and have a procedure done where they actually pull the clot from the brain, and then you can have promising results that will increase your quality of life. So, when you're getting here, we take you directly for imaging, we see what's going on, and then we take you either to the lab to get that procedure done that I was talking about, or we give you that medication immediately, or a combination of both, so that you can have the best outcome possible.
And then after the hospitalization, what would the patient expect, or what are the options there?
So we also have therapy services. We have a rehab center that looks at stroke and concentrates on stroke. We have all kinds of ancillary services that support the stroke program, including our stroke support group. We have a navigation program that works with our physicians to make sure that you have everything you need so that we can prevent further stroke or injury to the brain. So we have a lot of resources here that support the patient and the community.
It's reassuring when someone has a devastating issue like a stroke. It's nice to know that they can get their acute care and then their recovery care really close to home. It's important for our friends, families, and neighbors to realize that their support group that they need to, along their healing journey is close by them at all times, and having those services here are really important. I want to thank you very much for your time today, Jill. It's very educational, and I want to thank you guys for viewing, and we'll see you next time on Community Beat.